Hi, my name is Nicole Friedman and I am the Senior Health Coach at MJHS. MJHS is an expansive health system serving the greater New York area, and we were founded by 4 Brooklyn ladies in 1907. I'm here to talk to you today about the health coaching program. This program started on-site at Weill Cornell Internal Medicine, which is a large ambulatory care clinic associated with New York Presbyterian Hospital. It started as a way to help the diabetic patients who are utilizing this clinic feel better. We had a health coach on-site to meet with patients, understand some of the cultural, social, and economic barriers to care, and communicate this back to the providers that were helping them. I like to explain health coaching through a story that I think really illustrates how meaningful this is, not only for patients, but for providers and the community. I met with a patient over a year ago. This was a diabetic who was back and forth from the hospital, frequently using the ED, and despite having diabetes for 15 years, was still unable to control this disease. It was taking over his life. He was referred to me by his doctor, who was very frustrated and didn't know what else to do. I met with this patient and we started speaking a little bit about his life, what he liked to do, what he liked to eat, and I asked him, what do you think is the major barrier in your diabetes care management? And he told me that because he loved to cook and because he loved food and preparing food for his family, it was really hard for him to make such an important lifestyle change because it wasn't only affecting him, but it was affecting his family too. This is somebody who cooks Thanksgiving dinner for the past 7 years for his mother who lives in Virginia, and he takes the meal, he freezes it, and sends it overnight so that she can enjoy it by herself on Thanksgiving Day. Understanding how important food and the culture of food for this person was helped me communicate this back to his doctor. I suggested that maybe the next time he comes in for his exam, they meet together as a family. The social workers meet with his family, the nurses, and the nutritionists, all involved in providing care, so that they can work together as a family and change their food patterns. This is what the kind of care we have to do. Health coaching is now present on-site at Cornell, William F. Ryan, which is a large medical home uptown and downtown, the cardiac floor at Long Island City at SUNY Downstate, and also the Claremont housing in the Bronx. This is a service that helps the patients get the right care at the right time, and we do this by helping people without a primary care physician get an appointment after discharge within 72 hours. We also help patients schedule, keep, and do appointment reminder calls to keep them from the acute to ambulatory care setting. We also call them after they've left the hospital and make sure that they fill and understand their original prescription, introduce ourselves, and see if they would like to meet with us next time they come and see their doctor. For new patients, we meet with them, help them register, and even sometimes sit with them while they're waiting and make them feel comfortable and confident. This is a program about engaging people to be active participants in their health care, and this is what people need to do to feel better, and we recognize this. The 4 Brooklyn ladies were successful because they figured out how to expand care beyond the traditional exam room setting for the most fragile people in their community. For me, health coaching is realizing and continuing this mission by figuring out creative ways to expand care beyond the exam room, even if it's just in the waiting room, all the way to the patient's home, coordinating care and working together as a community to help people feel better. This is what we're really called on to do. Thank you.